This is The Broken Shift with Nurse Natalie. Healthcare doesn't break in chaos, it breaks quietly.
Travel nursing used to mean something very different. Years ago, when hospitals were bringing in travelers, they were bringing in reinforcements, experienced nurses, seasoned nurses, people who could walk into chaos, adapt quickly, and help stabilize overwhelmed units. But healthcare has changed. And now, travel nursing has become something else entirely. A financial lifeline for some nurses, a survival strategy for hospitals, and a symbol of resentment for burned out staff. And for newer nurses entering the field, sometimes a dangerous illusion, because online travel nursing often looks glamorous. You see it all over social media. Nursing is being glamorized. The money, the freedom, the contracts, the lifestyle, all of it. But what people don't always see is the reality waiting on the other side of that assignment. And I've been there. And this conversation matters. Thank you to the viewer who asked the question about nurses becoming travel nurses after 1 year, because this isn't about nurses anymore. It's about patient safety, healthcare collapse, burnout, mentorship, liability, and the slow erosion of trust inside modern nursing culture. And let me say this clearly before we start. This is not an attack on our nurses. Some of the strongest nurses I've ever worked with were travel nurses. Some units would completely collapse without them. I was a travel nurse. And some travelers walk into absolute disasters and help hold healthcare together. So this is not travel nurses are bad. That's lazy analysis. So let's not do that here. This is about asking a much harder question. What happens when healthcare systems stop building nurses and start cycling human beings through crisis environments as fast as possible? Because that right there is where we are now. The nursing shortage isn't coming. By the way, it's already here. The US is projected to lose more than 1 million nurses by 2030 through retirement, burnout, moral injury, and unsafe staffing, emotional exhaustion, and nurses simply walking away from healthcare entirely. And hospitals responded to this crisis by increasingly relying on travel nurses, float pools, registry staffing. I've done it all. Rapid onboarding. Been there too. Shortened orientations and emergency staffing models. Meaning, if you have a license and a pulse, you're filling holes. And during COVID, travel nursing exploded. Contracts skyrocketed. Social media glamorized it. New nurses watch travelers make double or triple staff pay. And suddenly, many nurses started asking, why stay staff? But here's the part people don't talk about. Here's the part people don't talk about. Just because you can travel after 1 year doesn't always mean you're ready. I'm going to say that again. Just because you can travel after 1 year doesn't always mean you're ready. I know that statement will upset some people, but we need to have an honest conversation, because 1 year into nursing, most nurses are still building confidence, pattern recognition, time management, prioritization, emergency instincts, and communication skills, delegation skills, critical thinking under pressure. That's a lot. And travel assignments often expect you to function independently very quickly. That's a huge difference. 20 years ago when I traveled, the nursing shortage existed, but not like this. Not like this. Units were more stable. They were more experienced nurses on staff. Mentorship culture still existed in many places. And travelers were expected to come in highly experienced because hospitals assumed you would function almost independently. I remember going in, and I think I had 1 or 2 days of orientation just to sign off some paperwork. So now, healthcare is so desperate for staffing that standards in some places have shifted dramatically. And newer nurses are entering the environment that can be incredibly dangerous if they don't fully understand what they're walking into. People see the money, not the liability. Travel nursing can absolutely change someone's financial situation. That's real. That is so real. But the liability is just as real as the paycheck. And that part gets ignored online constantly. Because what social media doesn't show you is this. You walk into a hospital you've never seen before. Different charting system, different medication setup, different pumps, different policies, different emergency protocols, different doctors, and different unit cultures. And sometimes you barely know where supplies are kept before taking a full assignment. Raise your hand if you've been there. Now imagine doing that while still building your foundation as a newer nurse. That's where things can become dangerous very quickly. I've seen how fast things can go wrong. I once worked with a travel nurse who gave insulin to the wrong patient. That patient coded. True story. And when I heard about it, I came in for my shift. I heard about it. I didn't sit there thinking, oh, wow, what a horrible nurse. Nope, that wasn't my first thought. My first thought was not, wow, what a horrible nurse. My first thought was, oh my God, that could have been me. And if you've worked bedside long enough, you understand exactly what I mean. Because nurses know how quickly things can go wrong in environments that are chaotic, unfamiliar, understaffed, emotionally exhausting, and constantly interrupted. Especially when you're working somewhere new. You're not familiar with that place. You don't know where the supplies are. Do you know where to go get that IV bag the doctor's asking you for? And that doesn't excuse mistakes. Patient safety matters. But experienced nurses understand something really important. Most serious errors don't happen because somebody woke up wanting to hurt a patient. Of course not. They happen when human beings are pushed past safe limits inside systems that normalize overload. And that is the conversation healthcare keeps avoiding. I want you nurses out there to answer this honestly. Have you ever had a moment in healthcare where you caught yourself just in the nick of time? And for those of you that are saying no, you will. The moment where you drove home, replaying your shift in your head, because almost every experienced nurse has had that experience. And most people outside healthcare have no idea how heavy that responsibility becomes over time. And let's not forget that support is a huge part of this conversation, because this is where the conversation gets really uncomfortable. Nurses online started saying something else too, that many units have become incredibly toxic. And honestly, there's truth there too. Some nurses online described eat your young culture, aggressive write-ups, hostility towards travelers, resentment over pay differences, and nurses refusing to help each other. Burnout turning people cold. Travelers are being treated like outsiders immediately. And if you've worked healthcare long enough, you've probably seen some version of this. Healthcare has created survival culture because nurses are burned out. And this is the real issue. Healthcare used to function more like teams. Not perfect teams, but teams. Now, many units function like survival environments. It's survival of the fittest. Everybody is drowning. Staff nurses are burnt out. Travelers are isolated. New grads are overwhelmed. Experienced nurses are leaving. Managers are desperate. Patients are sicker. And ratios are unsafe. And when human beings stay in survival mode long enough, trust erodes. Patience erodes. You lose your patience. Mentorship erodes. Where do you have the energy? Compassion erodes. You got to find it for yourself. That's all you have to give. And eventually, people stop seeing coworkers as teammates and start seeing them as threats. Or maybe even competition, because of the pay. And even as liabilities. That is dangerous because nursing is supposed to be a team sport. The loss of mentorship is a crisis. It truly is. I don't know what I would have done without my mentors. I worked at a community hospital my first year out of school, so this part worries me deeply. Experienced nurses are leaving healthcare in massive, huge numbers. And when they leave, they take pattern recognition, instincts, confidence, institutional memory, mentorship, and safety culture with them. When I first became a nurse, I relied on that experienced nurse next to me to guide me, to show me the ropes. Newer nurses are entering environments where the people who would normally guide them are already gone. That's facts. Or they're too burned out to teach. And then those same newer nurses are told, go travel, take the contract, and figure it out. That's not mentorship. That's abandonment disguised as opportunity. Because at the end of the day, it's your license that's on the line. Some travelers are holding the system together, and yet here's the contradiction. Some hospitals would literally collapse without travel nurses right now. That's true too. Some travel nurses walk into complete disasters and stabilize units that are already drowning. So again, this conversation cannot become travel nurses are bad. That's not what we're saying here. Because that's not the truth. Because the real question is, why are hospitals relying on emergency staffing models as a permanent solution? Why are so many experienced nurses leaving? Why are units functioning in perpetual crisis mode? And why are newer nurses entering survival environments instead of learning environments? That is the system analysis here. Another thing people don't talk enough about is identity, because nurses deeply identify with their specialty. Deeply. ER nurse, ICU nurse, trauma nurse, orthopedic nurse, flight nurse, cardiac nurse. These roles become part of who people are. So when nurses struggle, get fired, have contracts canceled, or make mistakes, the shame can be enormous, especially in high acuity environments where people constantly feel pressure to prove themselves. And unfortunately, some nurses weaponize that vulnerability against each other, especially when they're stressed, understaffed, and burnout. That's part of the darker side of healthcare culture that many people don't understand unless they've lived it. So I'm really curious. Do you think healthcare still has real mentorship culture anymore? Or has survival mode replaced teamwork? Do you believe that? Because I don't work in the hospital right now, but I see it online. And that's what it seems like to me, but I want to know what you think. Because if that's the case, this is not sustainable. A profession cannot survive long-term if experienced nurses keep leaving, newer nurses are rushed into unsafe environments, mentorship is disappearing, and staffing remains unsafe. And last but not least, nurses are not supporting each other. It's not sustainable emotionally, it's not sustainable clinically, and eventually patients feel it too. Because healthcare culture always affects patient care. Always. Whether hospitals admit it or not. I think a lot of nurses are grieving something right now. I know I am. It's not just burnout, but the loss of what nursing used to feel like. The loss of mentorship, the loss of teamwork, the loss of support, and the loss of trust, and the loss of safety. And underneath all the arguing online, all of it, I think many nurses are really saying the same thing. This isn't what I thought healthcare was, or this isn't what I thought healthcare would become. And maybe the most dangerous part of it all is that everybody is so busy blaming each other that the system itself keeps escaping accountability. When are we going to hold the system that's perpetuating this accountable? Because when nurses stop seeing each other as teammates and start seeing each other as threats, the system is already in crisis. And this is the part nobody talks about. Most nurses don't realize this until it's too late, until they've made a mistake, they're out on a contract, and they find themselves thrown to the wolves. This is The Broken Shift, where healthcare culture gets examined, not excused. If you know, you know.
Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.